Well, I'm very, very pleased to be here at the Pilgrim Hospital in Boston, where we're putting some money into the A&E. It's part of a national programme that the NHS asked for, and I said I want to stress this is new money. This is new money. I said I think 10 days ago on the steps of Downing Street that we'll be upgrading 20 hospitals, 20 new hospital upgrades around the country, and this is it. So we're starting here in Boston with 21 million going into the A&E, and that really helps expand the space that they have in the A&E. It gives them a better chance of moving patients through, stopping them blocking beds and so on, and it's much desired by the clinicians and the staff here, so I'm very pleased that we're doing it.
The Health Foundation said, though, despite this investment, it's still a drop in the ocean.
Well, don't forget that this is 1.8 billion of new money. It wasn't there 10 days ago. It's on top of the extra 34 billion pounds that we're putting into the NHS. And I've said that my job is to make sure that we use the funds that go into the NHS to reduce the time you wait to see your GP, the time you wait in A&E, and that's why we're doing it today. But I would also stress that it is vital, if we're going to fund our fantastic NHS in the long term, that we also have a strong economy, and that's what we're also working for.
One of the big things that this investment will be very welcome. However, the problems they suffer across the NHS, but particularly here in Boston, is staffing and recruitment. They're running for a nurse vacancy rate at more than 50% in the emergency department.
And that's why it's so vital that we're putting another 1.8 billion of new money, 800 million of that going on various projects, $1 billion on capital, but that's on top of the 34 billion that we're putting into the NHS. And of course, the lion's share of that will go on staffing, on attracting, retaining, professionally developing the staff in the NHS.
And in particularly hard to recruit areas like this part of Lincolnshire.
Absolutely, and I've made it my mission to ensure that people across the country do get to see their GP in time, do get through A&E in a reasonable time, and that's why it's vital to invest now. And I'm very pleased to be here, as I say, here in Boston, delivering 1.8 billion of new money.
Thank you very much.
Thank you. Thank you.